All right, we're going to get started. Welcome everyone to the Federal Innovation Through Prize Competitions webinar series. Today with our friend from the National Institutes of Health. My name is Phil Beloka, a contractor with Challenge.gov. To increase accessibility and inclusivity, I'll share a little bit about myself. I'm wearing a button-up shirt, long sleeve because it's getting colder. Today with me are some of my Challenge.gov teammates, Jara Metter, the director of Challenge.gov, Kat Kemp, Quinn Slayton, and Laura Barlow, and our special guest from the National Institutes of Health, Dr. Taylor Gilliland. Some meeting logistics before we get started. This event is being recorded. A live link to live captioning for the event is provided in the chat, or you can click the CC button at the bottom of your screen. You're encouraged to ask questions by clicking the Q&A function at the bottom of your screen, and you can also use the Zoom chat if you have any comments. By voluntarily attending this event, you agree to abide by the TTS Code of Conduct, a link which will be provided in the chat, and we ask that you leave the meeting if you do not agree to abide by this Code of Conduct. So now I'll hand it over to Jara Metter for a Challenge.gov overview.
Thanks, Phil. Hi, everybody. I'm Jara Metter. I really appreciate everyone joining us today from the federal government and also from the public. It's a wonderful opportunity to showcase some of the prize work that's happening across the federal government. So I'm the director of Challenge.gov at the General Services Administration. To promote inclusivity, I'd like to tell you that I use she, her pronouns. I'm a female. I have shoulder-length brown hair, and today I'm wearing my glasses and a red and brown sweater, and I'm joining you from my home in San Antonio, Texas. We're really excited for the second event in the Challenge.gov's, multi-part series on federal innovation through prize competitions. This series explores how federal agencies are using prize competitions and challenges to promote innovation, address important problems, and to advance critical initiatives that align with different agencies' specific missions. Each webinar session will highlight a different federal agency and their approach to designing, delivering, and scaling the use of prize competitions to promote innovation. Today, our special guest is Dr. Taylor Gilliland from the National Institutes of Health. Taylor will use this time to discuss how prize competitions fit into his agency's innovation strategy and what other federal agencies can learn from this work and how members of the public can participate in NIH-sponsored competitions. He'll provide an overview of how NIH is executing prize competitions, the organizational structure of NIH. He'll also touch on some of the different exciting competitions that NIH has sponsored over time. Challenge.gov is the federal government's central hub for prize competitions. At any time, members of the public can come to Challenge.gov and explore the dozens of active prize competitions that are open for your participation. And these prize competitions really cover a diversity of topics that may be of interest to you. Federal innovators can come to Challenge.gov and host your prize competitions on our free for you to use crowdsourcing platform. So we encourage you to check it out and engage with us if you have any questions. So back to our esteemed guest. Dr. Gilliland is a senior advisor to the director of the Division of Program Coordination, Planning, and Strategic Initiatives within the NIH Office of the Director. This division identifies and catalyzes research to address scientific gaps and opportunities. They foster collaborations, develop methods to enable research goals, and serve as an experimental testbed for innovative NIH-wide activities to promote the health of the nation. In this role, Dr. Gilliland also serves as NIH's Challenge Manager, where he oversees challenge policy and assists staff throughout NIH in the development and management of these prize competitions and challenges. And with that, it is my privilege to turn it over to Dr. Taylor Gilliland. Over to you, Taylor.
Well, thank you so much to Jara and the entire Challenge.gov team for being willing to showcase and spotlight really some of the great work I'm about to share with you at the National Institutes of Health and the work we're doing in prize competitions and challenges. So as already been mentioned, my name is Taylor Gilliland. I go by he, him pronouns. I'm a white male in my late 30s. I have short brown hair and wearing a light blue dress shirt with a gray blazer. And behind me, I have a blue background with the NIH and HHS logos. And I am joining you today from my home in sunny San Diego, California. So in my presentation today, I'm going to cover kind of four main topics. First will be a kind of introduction to the National Institutes of Health. And then we'll cover what a challenge is and why NIH leverages this open innovation mechanism. Then we'll go into an overview of the NIH challenge portfolio and provide you some examples of past and ongoing challenges that we are running. And then we'll close out with some thoughts on the keys to NIH's success in leveraging this open innovation mechanism. So let's go ahead and go to the next slide, please. So first, to orient us, NIH, or the National Institutes of Health, is one of the operating divisions of the Department of Health and Human Services. You probably have heard of many of our sibling agencies, such as the Centers for Disease Control and Prevention, the Food and Drug Administration, the Centers for Medicare and Medicaid Services. We also have some other agencies, including a brand new one, the Advanced Research Projects Agency for Health, as well as some you may be quite so familiar with. But together as a department, our mission is really to improve the health and well-being of citizens in this country. And part of the way we do that is what NIH is mostly involved in, and that is sustaining advances in the sciences that really underlie medicine, public health, and social services. Next slide, please. So NIH itself has a mission of seeking fundamental knowledge about the nature and behavior of living systems, and then the application of that knowledge to really enhance health, lengthen life, and reduce illness and disability. To put it nice, short, and sweet, we are turning discovery into health. Now, NIH is made up of 27 different components that are called our institutes and centers, or ICs for short, and you'll see that acronym used throughout this presentation, plus the Office of the Director, where I sit. Each IC has its own specific research agenda and often focuses on particular diseases or body systems. Next slide. Now, we can't have a government presentation without an org chart. So here's NIH's, and I do apologize for how small the font has to be in order to fit 28 different pieces of this NIH puzzle onto one slide. It does have to be quite small, but that's okay. If you can't read it, we do recommend you go to NIH.gov, where you can learn about each of these institutes and centers, again, that focus on a wide range of topics, such as the National Cancer Institute, our Eye Institute, our Heart, Lung, and Blood Institute, or others that are more focused on understanding broad areas of science or medicine, such as the National Institute of Nursing Research, our National Center for Advancing Translational Sciences, or our National Institute of General Medical Sciences. But it's important to understand we're a highly diverse, a very large organization with many different pieces to this NIH pie. Next slide, please. We are, as I mentioned, we are a relatively large organization. We are actually the world's largest biomedical and behavioral research agency. This past fiscal year, which just ended just a little over a few weeks ago, was over $47 billion. And the vast majority of that, almost 80 to 90% of that, goes out the door to fund researchers, clinicians, scientists, engineers around the country and around the world to do cutting-edge biomedical and behavioral research. So the vast majority of that wheel actually goes, again, to fund researchers outside of NIH. We also do have a large internal research facility and research laboratories with scientists and clinicians conducting their own research as part of our intramural or in-house research unit, largely based in Bethesda, Maryland, but with research facilities across the country. And so what that has delivered is really a fueling of the biomedical research enterprise in this country and supporting the world-class scientists, both within NIH and beyond, that catalyze new scientific fields, new tools, develop new resources that really has changed the course of science over our long history. Nearly every single FDA-approved medicine that is currently available on the market has, in some way, shape, or form, come from NIH-funded research. So the research that we support has really led to new ways to prevent, diagnose, and treat illness that ultimately improves the health of the nation and the world. And then, of course, we have a significant economic impact, really sustaining the biomedical innovation economy and bolstering productivity and reducing the costly burden of illness, both here and around the world. Next slide, please. So now we're going to pivot a little bit. So that was a really brief introduction to NIH. So now we're going to switch into what are challenges, also known as prize competitions. And you may hear me use that term interchangeably. And then we'll talk a little bit again about what are some examples of how NIH uses this open innovation mechanism. And then we'll wrap up with some keys to challenge success. So first off, there are kind of two ways on this slide and then on the next one where I like to introduce audiences to how we think about prize competitions at NIH. And the first is under this broad umbrella of open innovation in the federal government. And that is the recognition that there are brilliant ideas, brilliant contributions far beyond just the scientists and clinicians and other types of innovators within our own agency. And we have to be able to tap into that broad collective brain power around the nation and around the world. And so there are a lot of different ways in which we can do that, again, in that open innovation process. Some modalities you may have heard of are citizen science, open data collaboration, seeking new ideas through things like requests for information, engaging in open dialogue with community members, representatives, and organizations, and then through challenges and prize competitions. Again, I'll use those terms interchangeably throughout this talk. Now, a challenge for our purposes is simply defined as a program to award prizes competitively to stimulate innovation that has the potential to advance our agency's mission, as I've mentioned on one of the previous slides. Now, we can break that down real quick. Is to award prizes. It's typically in the form of cash or sometimes non-cash recognition awards, and to do so competitively. So, of course, it's within the name of prize competition or challenge, involves some level of risk, and it is a competitive process and has the potential to advance the mission of our agency, again, to really foster and fuel biomedical and behavioral research. Next slide, please. The second way I like to talk about it, and this is perhaps a bit more process-oriented for those of us who are within government and government R&D agencies, is that challenges and prize competitions are really just another tool within our biomedical innovation toolbox, mechanisms that we can use to catalyze cutting-edge research and development and translation and implementation science. For any of you out there currently listening in who are a current NIH awardee, perhaps you're a little more familiar with our more quote-unquote traditional mechanisms of grants or cooperative agreements or contracts, maybe even the flexible other transaction award mechanism. But I like to really stress to our team at NIH that really challenges and prize competitions are in that same toolbox. And just like you wouldn't maybe use a hammer in order to cut a 2x4 or use a saw to hammer in a nail, each tool can be specifically used to achieve a particular type of outcome or to solve a particular type of problem. So each one can be customly utilized to solve whatever challenge that we're being faced with. So that's just another way I like to kind of talk about it and have our staff internally recognize that this tool is always available to us when we have the right kind of problem that open innovation and through a challenge can solve. Next slide, please. So again, what are some of the reasons why NIH itself as an agency chooses to conduct challenges? And there's quite a few, and we'll kind of go through them here. One really critical difference between a challenge and some of our other mechanisms like grants and contracts is that we only pay for results. So it allows us as an agency to establish really ambitious goals that really, quote unquote, challenge the community, challenge the public to solve a problem, oftentimes pretty quickly, without really bearing that high level of risk of failure. That risk is really on the participant as to whether or not they're able to successfully deliver the outcomes that NIH is looking for. It also gives us an opportunity to really stimulate creative and unanticipated solutions to a vexing scientific problem. We're able to put out, the kind of parameters of what we might be looking for, some broad outlines of a solution we might need, but really leave it up to, again, that collective brain power of the public to come up with ideas we never really would have thought were possible. And one of the ways in which that happens is because a prize competition really reduces the barrier to participating in government-funded activities. And that allows us to reach beyond our usual suspects of our current NIH-funded ecosystem and really bring in new solvers, those out-of-discipline perspectives to bring them to bear to tackle on a problem that we're facing. And by that, increasing the number and diversity of solvers. It also allows us to draw attention and awareness to a public health need, and I'll show some examples of that by highlighting and trying to incentivize people to address perhaps a neglected health topic. It also allows us to, again, spotlight and draw attention to research data that perhaps is being underutilized, and that we really think if there are more computer scientists or coders or other types of innovators, if they could interact with the data, if we could incentivize them to derive new solutions, new outcomes from existing data. A challenge could be a really good way to do that. Another is that when you run a challenge, you have to define what is success. You have to kind of set up the parameters and the metrics by which submissions will be judged and evaluated. And sometimes in doing so, we kind of set what the new standard will be in that field moving forward for that particular type of solution or technology. And last, but not least, we've seen that prize competitions and challenges can be a great way to draw in private sector investment into a critical health need. Next slide. So you don't take my word for it. When we crowdsourced internally and embraced an open innovation approach internally and asked colleagues of mine at NIH, when you think about challenges, what is the first word or phrase that comes to mind? And these are people that maybe have been running challenges themselves for years, others who are brand new or had never really interacted with the mechanism before. And this is what they had to say. And of course, right there in the middle is innovation, innovative, but also things like fun, creative, hip, 100% worthwhile. I promise I didn't pay someone to say that. Timely, great for rewarding, flexible, show me the money even, transformational, and allows non-traditional innovators to engage. So, these aren't words from me, these are words from my community here at NIH, and I just think it's a great way to convey what some of our staff think about this mechanism. Next slide. All right, let's look at some of the numbers now for NIH's challenge portfolio. As I'll mention in a couple slides later, we really first got statutory authority to run prize competitions as an agency going back in 2011. That's kind of where we start on both of these charts. On the left, you'll see the number of challenges, unique ones that we've launched each fiscal year. And on the right, you'll see the total prize purse of all of those challenges launched. Again, on the left-hand chart, you'll see a kind of continual increase over the years. As we've gotten more and more familiar with this mechanism, we're running more and more challenges. And I'm really excited to share with you that with the end of the federal fiscal year on September 30th, when looking across how many challenges we launched in FY 2024, it was 22, a new record for us NIH. And I can say, amongst all federal agencies, there's a little bit of a friendly competition amongst us. And NIH is right there, up there, easily in the top 5, probably solidly in the top 3 at this point, although we'll have to see once all the numbers come out from our brother and sister agencies across government. We're definitely up there in the top tier. And then looking at the total amount of prize money, you can also see a pretty significant, almost exponential increase over the past few years in terms of the total amount of money that we're offering up as incentives to compel participants and innovators to participate in our NIH Challenge competitions, to where just last year we hit almost $18 million in prizes being offered. Next slide, please. When we look across some kind of portfolio-wide stats since 2011, we've launched 130 competitions. Really, fantastic uptake of this mechanism over the past decade plus. Total cumulative prizes we've offered is nearly $85 million. 95% of our challenges do offer a cash prize. And wow, do they range in terms of that cash prize purse in each individual challenge. Some, at the kind of the smaller end, at the low thousands of dollars, all the way up to the biggest we've ever run in collaboration with another part of NIH was a $20 million prize. But in terms of our more common, at the median level is a $100,000 cash prize purse. But again, more than 90% do choose to offer a cash prize incentive, possibly in addition to other non-cash incentives as well. What's also really great is, remember I showed you the org chart with 27 different pieces of the NIH pie plus the Office of the Director. I'm now can say that 2/3 of NIH institutes and centers have been the lead sponsor of a challenge, have seen utility in this mechanism, and have taken the charge and been a lead on a competition. And whereas as of this fiscal year, 100% of our institutes and centers have now participated at least as a co-sponsor if they have not been a lead sponsor themselves. What's also great is this mechanism is fantastic for incentivizing partnerships. Almost 2/3 of our challenges involve a federal or non-federal partner. Next slide. All right, so I'm going to give you kind of looking across the landscape and the types of challenges. And this is a courtesy of the Challenge.gov team who came up with these categories of challenges. And I'm going to show you some examples of each one. So these will range from analytics and software to scientific and entrepreneurship and recognition. So let's go ahead. I'm about to show you an example in each of these categories. We're going to go kind of quick because of time, but I think the goal here is to kind of show you the breadth and diversity of NIH competitions, some of which are ongoing, to give you a little bit of a flavor of how we utilize this mechanism. So starting off with analytics was this long COVID computational challenge. A huge problem we've been facing is how can we figure out who might be suffering from long COVID, also known as post-acute sequelae of SARS-CoV-2 infection. Long COVID is a little bit easier to say, so I'm going to go with that. So we have NIH, we've been funding the development of this large data set of patient information, health data. And we incentivized and ran a crowdsourced competition using de-identified secure data to see, can we develop AI or artificial intelligence or machine learning approaches to kind of identify who might be at highest risk of developing long COVID if they've had a positive COVID test, to help us see, can we come up with predictive approaches to identifying who might be at most likely to actually have long COVID based on health data information. This was a challenge led by the Office of the Director of NIH in partnership with many institutes and centers across the agency with a $500,000 cash prize purse. And on each of these slides, I'll break it down what the objective of the challenge was, and then an example winner, not necessarily the top winner, but just an example winner that I think represents the kind of solvers and solutions that come from competitions. In this case, from a collaboration from the University of Chicago and Argonne National Laboratory, where they built a real-time monitoring system that can really calculate a risk score for patients, and then can be visualized on a clinical decision support dashboard. Next slide. In the design category, the National Center for Advancing Translational Sciences has run this Rare Diseases Are Not Rare challenge for $5,000 in total cash prizes. And it was a great way to stimulate the rare disease patient community, typically, not recipients of NIH funding, but this is a great way to bring those non-traditional solvers to tackle a problem. And that was, how can we find really creative ways to communicate the importance of rare disease research? And I highly recommend you all check out this amazing video, the spoken word poetry, spoken word artist who has a rare disease, who shared his kind of vision of how his art can be used to spread awareness about rare diseases and the importance of rare disease research. So again, not something you would typically expect out of an NIH grant, and that's why we're able to utilize this open innovation and prize competition mechanism to engage folks like Jacob Thompson here. Next slide. And the entrepreneurship category, I'd like to highlight this challenge from the National Institute on Aging. It's a $360,000 challenge for startups and spinouts to really help them through a technology and entrepreneurship accelerator to foster entrepreneurial diversity and also to stimulate innovation and technology for older adults. And a great winner here from PopCheck Technologies, who is developing a remote patient monitoring technology that could predict surgical complications and improved post-operative care. Next slide. And the ideas or ideation category, we have an example challenge again from the Office of the Director, and this time with $1 million prize purse for the Complement Animal Research and Experimentation or Complementary Challenge. And this is where we were looking for some of the most cutting edge, most innovative ideas, whether in vitro, in silico, or in chemical and data ecosystems that could really shape the future of human-based biomedical research with these kind of new approach methodologies that are very effective at emulating human biology and integrating integrations thereof. So here we had an example from UC San Francisco, where they're proposing to utilize 3D printing technologies and 4D tissue fabrication to really accurately represent functional human tissue models. Next slide. In the scientific category, another challenge from the Office of the Director, but again, with a lot of collaboration from across NIH. Again, this mechanism is really effective at partnership formation. And that is this Targeted Genome Editor Delivery Challenge, or Targeted Challenge for short. The goal here, and this is an ongoing challenge, is to improve the in vivo delivery of genome editing technologies, either through programmable delivery systems, like imagine delivering a genome editor to a specific cell or tissue type or organ in the body, or perhaps even more challenging, using non-viral methods to cross the blood-brain barrier, which is a very difficult task, and delivering large kind of payloads, if you will. And as part of the phase 1 winner is a researcher from Indiana University School of Medicine that is developing CRISPR-based nanotherapeutics that can enable a dual targeting approach. Next slide. In the software category, from our National Cancer Institute, they ran a $100,000 metadata automation dream challenge. And the goal here was to develop algorithms to automatically annotate data fields and values from research data sets on cancer. This will increase efficiency of and efficacy of data analysis. And a winner here was from a team called CPath. And admittedly, data science is not my strong suit, so I'll leave it on the slide there to explain what that kind of solution was. Some of you on the call may have a much better idea than I, but essentially we're able to increase, again, the utilization of data by this automatic annotation of data fields from a cancer data standards registry and repository. Next slide. In the technology category, admittedly, I did choose one that I currently am co-leading, and we're just about to wrap up, and that is the Rapid Acceleration of Diagnostics Technology, or RADXTech, for Maternal Health Challenge, that the National Institute of Child Health and Human Development is leading in collaboration with the National Institute of Biomedical Imaging and Bioengineering, or my previous home at NIH. This is an $8 million prize competition that we're just about to wrap up, so stay tuned. We'll be announcing the final winners next week, where the goal is to accelerate the development of maternal health diagnostic devices and wearables and remote sensing technologies to improve postpartum maternal health outcomes in maternity care deserts around the United States. One of our examples of our phase 2 winners, we're now in phase 3, but going back to phase 2, was Caretaker Medical. And they're developing a wireless wrist monitor, and that is currently FDA cleared, and they are showing whether or not it can be effective in a postpartum maternal health population. that can continually monitor a lot of different cardiovascular and cardiac function measures, which can help detect the onset potentially of hemorrhage and sepsis and other cardiovascular conditions that can severely impact postpartum maternal health outcomes. Next slide. And lastly, but not least, recognition. And this was a $1 million competition that represented all of NIH. Again, this is a great mechanism for fostering that collaboration across our agency and with partners both within HHS and beyond. And that is this institutional excellence in diversity, equity, inclusion, and accessibility in biomedical and behavioral research prize competition, or the NIH DEIA prize. And the goal here was to recognize institutions of higher education, i.e. universities and colleges, that have implemented successful and innovative interventions for enhancing faculty and student DEIA. An example winner here is University of Puerto Rico in Rio Piedras, with their program that they developed to support diverse populations to engage in neuroscience-based research training, and has led to the successful graduation of dozens of participating students, and they advance in their neuroscience research careers. Next slide. Okay, so that was a very quick and very high-level kind of glimpse at the breadth and depth of the NIH Challenge portfolio. So hopefully you got a little taste of the many different ways in which NIH has flexibly used this mechanism to achieve a wide variety of goals. Now let's talk a little bit about what do I think maybe has contributed to NIH being so successful at using this open innovation mechanism. And I've broken it down into kind of the 3 Ps, policy, procedures, and practitioners. Next slide. So starting off with policy, may not be the most exciting, but for a policy wonk like me, I am in charge with overseeing implementation of our prize competition policy. So something that I think about pretty regularly. Let's first start off with the statutory authority. We are a federal agency, and we derive our authority to lead prize competitions by the America Competes Reauthorization Act, which was passed in 2010 and became official for the government in 2011, early 2011. From there, we have developed our own internal NIH challenge and prize competition policy that derives from that statutory authority. And what that does is that provides staff within our agency with really clear guardrails. That also allows for the flexible implementation of this broad prize competition authority that we're really appreciative from Congress to have. Some key things addressed in the policy include, but are certainly not limited to, what are some restrictions on participant eligibility? While it is quite broad, there are a few limitations on who is able to receive a cash prize from NIH. What are some features of a challenge announcement? When we publicly post all the details of a competition, there are certain things that have to be in there that we have to include when we're communicating to potential solvers. How do we handle things like intellectual property and licensing of technologies and solutions and submissions? How do we manage the payment of prize money to the winning innovators? And then who is responsible internally for our review, clearance, and approval processes? So for any other federal agencies out there, if you're interested in running a challenge, do always check to see if your agency has a policy or a directive first. And then if not, feel free to reach out. I'd be happy to share what NIH has developed internally and help your agency get started with this mechanism. Next slide. And then there's procedures. There's one thing to have a policy that sets kind of the guardrails and the minimum requirements. What we've also done internally is build a staff intranet page, a one-stop shop where all of our staff can go to learn about what is the mechanism, how is it used, what are some examples, and things that we have on there, like a challenge checklist, a step-by-step guide when you navigate the life cycle of a competition. Again, how do you go through that review, clearance, and approval? What is needed? What are the steps along the way? Templates. Everyone loves having a template to work from. What are the minimum requirements for a challenge announcement and participant registration? And then also other helpful resources and tools when thinking about prize competitions, challenges, and open innovation. It's also really has been effective at NIH is that we've established an interagency agreement, or IAA, with our friends over at NASA at their Center of Excellence for Collaborative Innovation, or COSI for short. And they have provided a fantastic service to all of US government agencies, and they provide them streamlined access to a pool of challenge contractors who could help us with the design of challenges, communication and outreach, management, and evaluation services. We also have an internal challenge reporting system that we use to be able to kind of keep track of what's going on across that diverse portfolio of competitions, and also to provide the information we need to provide in the biennial report to Congress that all agencies report to showcase what we've been doing with this authority. Next slide. So real quick about that IAA, or Interagency Agreement with the NASA Center of Excellence in Collaborative Innovation, or COSI for short. Again, that provides all of NIH with a really streamlined, fast, and efficient way to procure open innovation and challenge contractor support services. And so we've taken kind of a bookend approach to how we utilize contractor support across the challenge management lifecycle. Typically, a new idea for a challenge or prize competition bubbles up from the grassroots within NIH. A scientific or clinical program manager or administrative official has an idea, has a spark, or how we can creatively run a prize competition to solve a problem that they're facing. And then we'll start internally working with their team. I will work with their team to kind of design and develop a challenge. And maybe that's where we'll start thinking about procuring a vendor support. But then we'll go through our internal approval processes. And then typically is where we really work with a vendor, with a contractor, to help us kind of announce and advertise the challenge, provide a platform for submission management, receipt, thinking about creative ways to get the word out there to incentivize participation, and then to help us with the management of communications with innovators, and then the judging and selection of winners. And then we'll go back to our internal procedures for how we pay out prizes, and then submitting any necessary reports. So kind of a bookend approach to leveraging NASA's open innovation services. Next slide. And then, of course, the practitioners, the people, the third P here. I have been fortunate since the summer of 2018 to be NIH's dedicated, although part-time, agency-wide challenge manager. So I'm really, as I mentioned, tasked with providing oversight of challenge policy, and I support all of our institutes and centers and their utilization of prizes and challenges. So I provide annual and on-demand training for agency staff, again, coordinating across that really broad and diverse portfolio. I am the first line of review for all prizes with a total prize purse above $50,000, and then represent NIH in our federal community of practice, and get to learn and share best practices with my equivalents across the US government. But within NIH, again, that 27 different institutes and centers, we federate out the process of kind of challenge management. We have a train-the-trainer model. So each institute and center appoints their own designated internal challenge manager, who then I liaise with, and they assist their local staff with challenge design, management, implementation. Now, it's important to note, NIH, we really take again, grassroots from the bottom-up approach. There really is no central NIH fund to support new competitions. And there's no agency mandates to launch challenges. All concepts really come up from those who are working day-to-day in their particular clinical or scientific or technological areas. And so building up that staff training and awareness is essential. Next slide. And lastly, when we talk about that train-the-trainer model, here are some of those responsibilities, again, that I help oversee across those 27 institutes and centers. Each has their own designated challenge manager, where they're responsible for helping their challenge leads draft the challenge announcement, go through that approval process, get that Challenge.gov posting. Quick shout out to Challenge.gov colleagues, again, for providing that amazing platform we can use to get the word out about our prize competitions. Again, serve as that liaison to me as the agency-wide challenge manager, manage that judging and winner selection process, dispersing awards, and filing reports. Next slide. And so this is my last one, and then we'll open up for Q&A. I did just want to show you real quick, this is all the ongoing active challenges we currently have. And you can see here in the top 4 that are closing for submission this month, including a challenge I'm co-leading right now with the RADx Tech Act Indo Challenge for novel, non-invasive diagnostic innovations for endometriosis, as well as quantum computing challenges, data sharing and data access challenges, and then a genomic data commons analysis tool challenge. So there's just 4 of the many that you can see here that we have ongoing, who their lead sponsor is, and what their upcoming deadline is. So please do go to Challenge.gov and look at all the ones that NIH has active, and we do encourage you to compete in any that are of interest to you. Next slide. And we'll just close it here. I believe we'll go into a Q&A session next. But if you have any ideas for collaboration or feedback, you can reach me at nihchallenges@mail.nih.gov. Thank you all so much.
Thanks, Taylor. Thanks for that really comprehensive overview of how NIH is approaching prize competitions and challenges. While my teammate Kat Kemp is gearing up for the Q&A session, I have a question I would like to pose to you. In one of your slides, you demonstrated that prize competitions have been scaling at NIH. I think you showed a doubling of prize competitions in the last 3 years, and this like massive increase in prize purse expenditure from I think $2 million to $18 million in fiscal year 24. So prize competitions are scaling at NIH. Where do you see the prize program or the use of prize competitions in sort of the near term, like in the 5-year range from now at NIH?
Yeah, great question, Jared. Thank you. So first, I would really like to see us kind of continue that growth, continue to get to 100% of our institutes and centers that have been the lead sponsor of a challenge. You know, we're already at 100% for at least co-sponsoring. We'd like to see everyone having seen how they can utilize this mechanism to address their own individual institute and center missions. So that's one, that continue that growth. I'd like to continue to see us use this challenge mechanism to solve bigger and more complex technology and really pushing the edge of cutting edge science. You know, we're beginning to see more, you know, some more and more examples of that. You know, I showed you that $6 million targeted challenge for genome editing delivery technologies, the RADx Tech series of challenges that I'm running that are really advancing medical technology development. So I'd like to see more and more of that, as well as, you know, they may not be the big dollar prizes, but seeing more and more parts of NIH engage non-traditional solvers, like high school students, undergraduates, nonprofit community-based organizations, to utilize this mechanism to bring more and more solvers into the NIH-funded ecosystem. So I think those are some of the things I would like to see moving forward.
Great strategy for opening doors for innovation. With that, I'd like to turn it over to my teammate, Kat Kemp.
Great. Thank you, Jara. And thank you, Taylor. What a wonderful presentation. And just being able to see how the breadth and depth of prizes and challenges at NIH and all the different ways that NIH is using this tool. Welcome, everyone. As Jara said, my name is Kat Kemp. I'm a contractor with the Challenge.gov team. I use she, her pronouns. I have chin-length brown hair, and today I'm wearing a dark blue collared shirt that has white polka dots on it. Many of you have been dropping questions in the Q&A section. If you haven't found it yet, typically it's at the bottom of the screen. There's a little Q&A icon. You can click that and add your questions into the box. But we have about 15 minutes left and a lot of questions. So Taylor, I wanted to start with one that came in through the Q&A while you were talking. What metrics does NIH employ to assess the effectiveness of its challenge programs?
Thanks, Kat. It's a good question. So I will say, as hopefully you saw from the presentation, is how diverse these challenges are, from $3,500 design and multimedia challenges to the multi-million-dollar, multi-year complex biomedical engineering challenges. So there's no really one metric we can necessarily use across that really diverse landscape and portfolio of competitions. But here's some of the things we look for. One, did we get the kind of solutions we're looking for? Because if we didn't, then that means maybe either we didn't design the challenge the right way, or maybe we're a little too ambitious and expecting what we could incentivize from solvers. Maybe all our incentive structure just wasn't quite right. So we want to see first and foremost, did we get really innovative solutions that we didn't expect? Another way we look at the effectiveness of the mechanism, were we able to engage non-traditional solvers? Yeah, really, to me, is one of the single most important factors for a prize competition. We don't want to get just the usual suspects, if you will, the people who are already part of the NIH-funded ecosystem, although they certainly are encouraged to participate in those challenges as well. But we want to see, because a prize competition really lowers that barrier to entry, lowers that, the requirements to participate in NIH activities. We really want to see that we got beyond people who already know about NIH, who are already engaged in our biomedical research innovation ecosystem. So those are just kind of two metrics we typically look at in terms of challenge effectiveness.
Yeah, and I think what your presentation and the work across NIH just shows that every challenge is so different. And I think that, in terms of differences around eligibility, differences around what they're asking for in terms of the solution being submitted, it really is something that has a lot of different ways to be able to then engage the public, engage researchers, engage people, the whole research continuum from perhaps high schoolers to other postdocs or other funded researchers. I wanted to ask, as you are working with your colleagues across NIH, this question also came in through the chat, and talking with people about deciding to run prize competitions. Chicken and egg, what is a bigger challenge that you hear from your colleagues? Finding good projects and ideas, or finding the funds to execute those projects? And how do you and your colleagues tackle those challenges?
Well, I will say, we are fortunate. We are usually never too short of good ideas for prize competitions. And we are never too short of amazing solutions coming from brilliant innovators from around the country. So usually it's trying to convince others in the value of this approach. That's a constant learning exercise with NIH, and you've seen that growth, and that's partly because we've become more familiar with this mechanism, this open innovation approach. And so you're seeing broader utilization because people are seeing that it is effective, seeing internally that data, that it is working, that is delivering solutions. So there's kind of a more comfort with the open innovation, more of that tool, just another tool within our toolbox that we all carry around. So I'd say there is that challenge, to use the term, in getting people to buy in and trust in the approach. And then, yes, there are some times, it can be difficult to, when dollars are already committed, or if they're tight, to find sources to fund the prize purse of a challenge, or to fund operations of a challenge. Although, again, really to stress that partnership aspect, we've been able to, if one part of NIH maybe doesn't have quite the prize purse in hand that they need to incentivize participation, they can leverage partnerships and get co-funding from other parts of NIH, other parts of the Department of Health and Human Services, other federal agencies, or even non-federal external partners.
Wonderful. I want to take a question that came in through our registration process that speaks specifically to our those in our audience who represent other federal agencies and part of our federal community practice. The question is, for an office newer to prize competitions, do you have any recommendations for building a timeline to plan a prize competition?
Absolutely. So for the first time, it always takes longer than you think. When I'm advising new teams with NIH who are utilizing a challenge for the first time, I tell them never underestimate how long it's going to take to refine your problem statement. Really being able to come up with a clear, crisp, concise problem statement of what you are expecting your innovators to solve. It's so crucial, and sometimes we really underestimate how long it can take to really clearly define that, so that you can convey to your innovators, this is the problem we want you to tackle. Be creative, deliver outside of the box solutions. We're not in the position to know exactly what's coming in, or else we wouldn't be doing a challenge to begin with. But being able to really invest the time in that part, and then the time it takes to go through your review, clearance, and approval processes within your agency, especially if agency leadership is not well versed in prize competitions and challenges. You really want to make sure you invest enough time to get through and answer questions as you go along, and have the kind of justification your agency needs in order to obligate the funds for a prize purse. And a little insider tip, be best friends with your Office of General Counsel. Your lawyers are your friends, and you need to make sure that you work closely with them, especially if this is your first foray into the challenge world.
Excellent. Another question that came in through the Q&A box today is about SBIR and small business and innovation research. And one of the questions about sort of how does SBIR intersect with challenges and prizes, and are you still using accelerators for SBIR across the NIH?
Yeah, so again, I think that National Institute of Aging Challenge, that startup accelerator, the idea is they could bring in diverse entrepreneurs who would go through this kind of boot camp and this accelerator approach, get lots of training, and then be more competitive for SBIR grants in the future. And sorry, that stands for Small Business Innovation Research, which we have a pretty large portfolio of here at NIH. These are grants to small businesses, small companies, to conduct research and development and deliver innovations that will improve health. Another really great example I like to highlight, and this is a challenge that's been going on every year for quite a number of years now, and that's from our National Institute on Drug Abuse. And they have what they call a Substance Use Disorder Startup Challenge, $100,000 challenge they run almost every year, where it's to bring in new ideas for new startup businesses in the substance use disorder space, or treatment, prevention, et cetera. And so the whole goal of this challenge is to bring in and help new potential companies get formed by going them through a pitch competition, and then providing them assistance when it comes to applying for their first SBIR grant application, or submitting their first SBIR grant application. So there's a lot of different ways which we utilize challenges and the SBIR grant mechanism or contract mechanism together to help reinforce one another.
Staying in the scope of thinking about those in our audience who are potential solvers or potential applicants for challenges and prizes, are there any, can you talk about, in some of the examples that you gave, about what the products that are delivered, some examples about, what are the submissions that people can be thinking about, the level of depth to prepare, from the types of different submissions that different challenges ask for?
Well, again, hopefully you all saw from that presentation, it's could be very much from you're submitting a video, a link to a YouTube, to a video that you produced. Maybe an example, one of the RADx Tech challenges. Again, these are all about, it's a med tech accelerator for diagnostics, wearables, remote monitoring technologies. It's a 3-phase challenge. Phase 1, written submission. Respond to a series of prompts, describe your technology, any performance data, describe your team, describe your plans for further development. So it's a written submission in phase 1. Phase 2, a couple of our challenges, it's a live, either in-person or virtual tech demo and pitch event, where you actually have to present to us live, show us your technology, pitch your company and your medical device to us. So that's phase 2. And then phase 3 was a 6-month to a year or more long technology development sprint, where you have to hit certain technology development and maturity and timelines and milestones and deliverables throughout that challenge. And there's multiple opportunities to win cash prizes and receive wraparound consultant support throughout that third and final phase of that competition. So that's just one example. But again, it can really vary depending on the specifics of the challenge as to what's typically required. For any of you who are current NIH awardees, take everything you know about applying for an NIH grant, put that on one side of your brain, and start fresh, because the challenge is completely different and unlike anything you've probably seen.
Yeah, I think that point about like you have to just start totally fresh and see what each challenge is asking for, and what the different criteria are. We did get a lot of questions through registration about eligibility. Questions around it are, small businesses apply? Do you have to have a PhD to apply? About what are sort of the different factors? So who is eligible to be able to participate in NIH-sponsored prize competitions?
Yeah, very good question. So they are the minimum eligibility requirements, which are set by the America Competes Reauthorization Act. So our statutory authority to run prize competitions. It sets that in order to win a cash prize, you must either be a U.S. citizen or permanent resident, or a legally established entity in the United States with a primary place of business in the United States. So those are the minimum requirements. Each challenge may narrow the field a little bit more. Like maybe you have to be an undergraduate student majoring in biomedical engineering, for example, or you have to be a 501c3 registered nonprofit organization, or it's just completely open with those minimum requirements set by the Competes Act. So in order to pay cash prizes to someone directly, they have to be a citizen or permanent resident of the United States, or an entity. Could be a for-profit company, a nonprofit company, a state, local, or territorial or tribal government. They just have to, of course, be within the United States and have their primary place of business here.
I am skimming through the questions. Thank you all for submitting questions and putting them into Q&A box. For those that we are not able to answer or respond to in this session, then we are making note of them so that they are captured. So we did have a question about, similar to the question that Jara asked about fiscal year 2020, any challenges that were launched in fiscal year 2024. Are there any that you are most excited about or looking forward to when it comes to seeing those results?
Well, you can't make me pick my favorite children. So I don't know if I'll pick. I would say, again, just go to Challenge.gov. You can filter for National Institutes of Health and take a look. I mean, I'm particularly excited about some quantum sensing, quantum computing challenges. Again, that endometriosis diagnostics challenge. I mean, what an intractable problem for millions of Americans. That we've got to be able to stimulate new innovation and diagnosis of endometriosis. Data sharing, translational science education, engaging nonprofit organizations focused on disability health. There's just too much exciting going on. So go to challenge.gov and you can pick your favorites.
Well, thank you, Taylor. With that, say thank you everyone for joining us today. We'll be dropping into the chat box that we will have a brief survey, a few questions just to give us feedback on this event. Also encourage you to join us for the next events within our webinar series, Federal Innovation Through Prize Competitions. We are going to have a conversation with the U.S. Agency for International Development in November, and with our friends at NASA, National Aeronautics and Space Administration, in December. So in the chat is registration. You can register for those directly. This event is recorded, and we will send out a link to this recording once it is posted. And finally, stay up to date on all the challenges from NIH and every federal agency by joining our federal newsletter. With that, say thank you very much and have a good afternoon.
Thanks, everyone.